When many people began working from home 1 year ago this week, the doctors and nurses at the Syracuse Community Health Center couldn't retreat.
They were the first to test for coronavirus, and they take a moment now to reflect on a year unlike any other. With News Channel 9's Andrew Donovan.
The tent and surplus of supplies
We were going through a bucket of these in every 1 to 2 hours a year ago.
are way more elaborate than when Zarina Smith did the very first coronavirus test in central New York.
When somebody would come through and say, I've had a fever and I'm coughing, and you would almost look at the patient and think they definitely have it, very, very scary to swab them.
It looked scary to see nurses in hermetically sealed suits in a downtown Syracuse parking lot. As the first option for testing in town, people came from all directions and all walks of life.
I could tell you stories about folks who came up from New York City because this was the only place they could get tested.
The pandemic better exposed minority groups' lack of access to health care. It's a decades-old problem and the reason the Syracuse Community Health Center exists. And it's a disparity that's continuing as the health center transitions to vaccinations.
There's long-seated distrust of our medical delivery systems throughout the country, and part of it is how African Americans have historically been treated.
The center is now a federal vaccine site to get shots to 30,000 pre-pandemic patients who come here for everything from dental to mental health.
Not just to the south side, not just to the constituents, which are primarily African American and Hispanic, but to anyone who comes to our doors.
The center isn't new, but it took a pandemic for some people to notice. In Syracuse, Andrew Donovan, News Channel 9.
Year to date, the center has done more than 50,000 coronavirus tests and will keep doing so as it adds a vaccine drive-through to its parking lot in the coming weeks.